We all have our trials, but we're never alone. That's what makes our trials triumphant. Trials and Triumphs with your host, Pastor Ladina Boo.
Good morning, it's Pastor Ladina Boo from Stockton, Missouri. And today I have a guest, Camille. And Camille is with dtranshelp.org. And she agreed to come on today and tell us a little bit of her story. And, you know, because you went ahead and started transitioning to a male, correct?
So, and that's kind of the confusing part, and the part I don't, it's difficult to wrap my head around, because what happened was that I believed I was non binary. So that I was this kind of like in between gender,
Mm-hmm.
this um, really something like I rejected both roles, like
Right.
both the female role and the male role. Like I was rejecting that, and I didn't feel comfortable with being a woman or a man. So I thought I was non-binary. And so what's surreal about it is that my doctor, two mental health professionals, and my surgeon all approved of this non-binary top surgery that they performed on me. And it's just surreal, because when you look at it, there's no equivalent to a non-binary, um, you know, sex in the human species. Like we can say female, we can say male, but we can't say non-binary. It's
Right.
not the same like, as intersex, which I know that's a whole argument, but that's not a third gender. That's just in between.
Mm-hmm. So,
Mm.
how old were you whenever you were seeing all these physicians and mental health professionals?
So like this sort of gender, like I started having issues around with my gender um, in grade school. So I had a traumatic experience. Well, it was secondhand, but my best friend was raped by her brother, and I it really impacted me negatively. I started dressing more masculine at that time, and I had seen a bunch of different therapists for this. And then when I was in college, I was introduced to this idea of being non-binary, um, and then I saw a couple therapists because I was still struggling with my issues. Like I wasn't getting the help I needed. So I saw a therapist, or I saw a therapist, and she was gender affirming. So she didn't push back on any of this, and she didn't look into my trauma as a source of me wanting to transition. Because if you were to do that, then you'd be considered transphobic in
Right.
those sort of circles. So um, I did see that. I did try and see that, and then I talked to my doctor about transitioning, and then um, that's kind of how that happened.
Yeah. It's difficult for my mind to wrap around the fact that, you need some mental health, you need some trauma counseling, you need this, but instead, because it's politically correct to do this these days, and you don't want to be labeled as transphobic or something, and I think that's overriding the health issues of the people that are coming to see them. It seems like it's very easy these days for someone to go in and say, I'm not comfortable, and all of a sudden they want to do surgery on you, and that's not going to help you in the long run. You need to figure out why you're wanting to do this.
Yeah, and it's I've been shocked about how, and that was part of why the reason why I really wanted to do something like Detrans Help and participate in that, was because it's surreal to me how experimental this was. Like when I first detransitioned, I thought I was one of the very few of them. Like I didn't think that there was all these other people who were transitioning and then subsequently detransitioning. Like I didn't think that that was this huge issue that it is. But I'm seeing hundreds of people online, and they're all of them struggling with similar issues. They had a history of trauma. Many have a history of sexual violence. Many of them are gay, and they were like, well, I want to be trans because then I'd be straight and I'd be more accepted. There's seems to be, in many cases, an element of escapism
Hmm.
from struggles that people are dealing with when they look to transition.
Yeah. Now, you went so far as to have top surgery, correct?
That's correct.
Has it caused you any health issues after doing that? I know that the research I've read on uh, transitioning shows that, you know, especially if you're starting with young children that really don't know what they want, they're seeing all this in the schools and on the TVs and everything like that, and all these little kids that are doing the drag shows and things like that. And, I don't think they have the mental capacity to make that particular decision. And when their parents go ahead and allow this to happen and talk to their doctors, they're not looking at the long term effects of the puberty blockers and the cross sex hormones and, all the health issues that you're going to develop after all of this goes on.
Right, because there are well, it's weird because Lupron, from my understanding, was used as like for castration, like
Hmm.
for somewhere. But it's like weird because it is like, what are the long term effects? And then they're doing a lot of this off label, which is concerning too. Like, I mean, technically mine was off label too for the top surgery because it was labeled as a mastectomy. Um, it's very weird. They're not, there's no consistency in like how much of a dose for testosterone people are getting.
Hmm.
So we'll have somebody who's female and she's getting testosterone put in her body, but that dosage of testosterone isn't going to be consistent because I've heard horror stories about women go in and they get testosterone and they're like, well, give me the highest dose. And then they give them a really high dose of testosterone. And it's concerning that there's no standard on top of the fact that they're not even like looking at underlying health issues because looking into anything is going to have you deemed as transphobic.
Yeah, and last time I checked, the doctor's little creed thing says first do no harm. And I'm seeing a lot of harm with children and adults who choose to transition. And I know I looked at research figures the other day, and they said over 50% of those who have transitioned are suicidal. And, I would just really like to get the word out there about, this transitioning is not good for your health. It's not good for your mental health, your physical health, or anything of that nature. And there's very few organizations that want to help with detransitioning, to my knowledge. Is there?
There's the only one I really know that's actually helping detransitioners is GenSpect. So Detrans Help is one of the few. I mean, there's probably other ones out there. A lot of them that I'm finding are for actually parents. So there's a lot of parent groups out there who are fighting against this. But
Hmm.
yeah, it is difficult finding um, resources. I think the only other one that I'm thinking of now would be Geta. Geta has been a good resource, and um, they're more like therapist focused. But Segem's not even. Then that's kind of the tricky thing, and what Detrans Help is hoping to do. Like we want to create an advocacy, at least a self advocacy program. Hopefully, we can work with doctors to do an advocacy program, and we want to do case studies. But the thing is that there seems to be a lot of focus in the detrans for detransitioners. There seems to be this focus on mental health rather
Hmm.
than looking at the physical health issues. And that was the issue for me, was that I had high CRP levels, which is a biomarker that you can find this out through a blood work test. And I had high C-reactive protein, so I had high inflammation in my body. But nobody was checking this out because they always had thought my issues were linked to my mental health. So they had
Right.
thought, well, you're just depressed, you just have generalized anxiety disorder, um, and you have ADHD, like you just need to take medications. So for me, they didn't think that, well, maybe there's something else going on. So once I started addressing my inflammation in my body, then I actually started thinking more clearly. I no longer have generalized anxiety disorder, which is something which is remarkable for me because this is something everybody had approached to me that you're going to have to live with GAD for the rest of your life.
Mm-hmm.
So it is, I'm really hoping that D-Trans Help can start bringing physical health to the discussion and how that's impacting us mentally. Because there is, I mean, we don't know how much of this whole entire issue is because of maybe it's the environment, maybe it's what we're eating. We just don't know because it's just not being looked into.
Yeah. Now, whenever they started this with you, did they do any kind of extensive blood work or allergy work, stuff or anything of that nature? Just, I know going to the naturalist in my town, he'll take your blood and he comes back with amazing findings. And, he's helped numerous friends of mine get past their medical issues that the regular physician never even considered, didn't get into the blood work and examining all of that so extensively. Did they do any, major stuff like that as far as your blood work and checking out your physical health before this started?
Not at all. So it was pretty much what it was. Is I saw my primary care physician, and I said I'm non-binary. I want to look into breast reduction because originally it was like that was the request was breast reduction. So
Mm-hmm.
because to be honest, I wasn't sure what I wanted. I just knew that I had all this discomfort with my breast, and I just wanted them gone.
Right.
So I reached out to my doctor. He didn't run any labs. He just referred me to somebody, and then this person, who's a part of the hospital I was going to, they connected me with these two mental health professionals. And the two mental health professionals never talked about my physical health. They actually acknowledged my trauma, but again, because of how things are set up, if you question the trauma, then you're transphobic. And so there wasn't any discussion of like, well, I see that you have this history of trauma. I see that you have history of suicidal ideation, of depression. Like, we need to, like, maybe, like, you need to get this under control, or like, maybe you're not a good candidate for that. Like, that was never even discussed in these meetings. It was just sort of like, okay, like, we had a 40-minute meeting, a 50-minute meeting with another one. And then they just, then I had the approval I needed. But the other thing that's kind of surreal, kind of going a little bit off topic, is that this is the first type of surgery that we're doing for mental health since lobotomies. And
Right.
so it's weird. It's a surreal. It's just the whole thing is surreal.
It's kind of heartbreaking to me, my daughter's in the medical field and so forth. And to think that various doctors do not want to, you know, dig in deeper and find out what's going on with a person physically or mentally and everything because they're afraid of being labeled transphobic. When did transphobic take the place of, caring for your patient? One way or another, you need to take the time and find out what's really at the bottom of everything that's going on so that they can make an informed decision, and it doesn't sound like you really had that kind of, you know, eh, looking into your physical health and looking into your mental health. If you got a 40-minute session and a 50-minute session and they say, okay, fine, you can go do this surgery, that seems like you're really doing a disservice to your patients.
Right. Especially like when those sessions are just, it's just a confirmation bias. It's not actually digging into it. And it's just, it's sad because it is this one-sided conversation of like, well, we just have to have like mental health letters saying that you're fit
Right.
for the surgery to go do this surgery, when I wasn't fit for the surgery. And it, it it's just it's surreal too that there's not any sort of look into the physical as well. It's not like, well, let's look at your CRP levels. Let's see if you have high inflammation in your body. Let's see if you, because my endocrines, I never saw an endocrinologist. And now we know I have thyroid issues. So, how much is my thyroid impacting my other things? My other issues in the body. Like, I also, um, there's, it seems that I'm struggling with PMDD. So, like, right before my monthly cycle, well, it's not even really monthly because it's irregular. It's like I'll struggle with severe depression and sometimes suicidal ideation. And this is something that I'm finding out as I'm getting better, because as I'm getting better, these other issues are coming up. And it's just surreal because I'm having a lot of health issues that I'm working through. And as I'm working through these health issues, new things come up. And I'm like, wow, I had all these underlying health issues that I've been able to find out since getting past my generalized anxiety disorder. And nobody's, gosh, it's weird. It's again, it's surreal to me because nobody was willing to look at the physical health for me and
Mhm.
kind of try and see if maybe that was causing all this discomfort. Because once I addressed the physical health, the discomfort with, because I had both discomfort with my breast and my hips, and the discomfort with my hips was why I went and got this surgery. But when I
Mhm.
addressed my physical health, then the discomfort with my hips went away. So, like,
Right.
I didn't feel self conscious about my hips anymore. So, all I needed to do was address my physical health.
That's amazing. And to think you went to all those doctors and they didn't, figure it out before you uh, went and transformed your body in some fashion. And now, when we spoke previously, you talked about the fact that it's very difficult to the insurance companies and things like that to detransition. They don't have, any insurance coding or whatever, in order to address the issues of trying to detransition at this point.
Yeah, so the ICD 10 code is a classification code for insurance, and it says, okay, here's the diagnosis so that you can treat the patient. And we have nothing for detransitioners. Like, there is no ICD 10 code for us. And so it's concerning because you can transition, but you can't detransition. So we're seeing a lot of detransitioners that they want to get reconstruction surgery or they want to get their implants removed. And they can't get these surgeries because there's nothing in the medical system that says that we exist. And so it's been difficult for a lot of detransitioners to get help. On top of the fact that many of us don't trust the medical system because they have been so they have not done they have failed us.
Yeah, I agree with that. They seem to have failed everybody dramatically in that respect. They're more concerned with the politically correct way of operating instead of the medically sound operation, it seems.
Right,
You know,
there.
we,
I mean, like you're saying, first do no harm.
hmm
Yeah.
and it doesn't seem like they want to take that into consideration sometimes. It's just like you say, they don't want to be labeled as transphobic. And, I don't want to be labeled as transphobic, but, I'm looking at these news articles where, okay, well, we have twin little boys, and when they're with daddy, they're little boys, but when they're with mommy, well, then mommy wants one to be a girl. And so she's starting that, and they're 7, 8 years old, and things like that just really disturb me. It's like, you need to be looking at this. You need to let the children get to an age where they understand what they're doing before you start this. I think you're harming your children. I think that's child abuse, in my opinion.
Yeah, yeah, it's sad because there's a lot of parents too that are being told like this is what you need to do, like otherwise your child's going to kill themselves, and that's emotional manipulation.
Hmm.
And it's it's difficult. I think some parents are just trying to do the right thing, and what they're not being told is, well, if you put your kid on these puberty blockers, they're not going to have sexual function later. You know, it's 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 terrifying what's going on right now in our medical system and how doctors aren't being honest about this. I know in the groups I was in, because I had a binder and I used it twice because it was incredibly uncomfortable. And I found out later that the reason why they tell you, because all they would say is that, well, just make sure you don't wear it too long. But they don't tell you how it can lead to deformity or tissue damage. They don't tell you that. And that's really the concerning thing for me, is that there's this lack of honesty around these surgeries, and around things like binding. I know, um, yeah, it's just like I'm just surprised, kind of getting out of those kind of, like, because I was in far left circles, I was at Portland State University, I was like really in the heart of all this, and
Hmm.
gender ideology, and they don't discuss at all the reality of the situation.
Yeah, I've listened to a lot of um, people who have transitioned and talk about the damage they've done, like if they're transitioning from male to female, the pain factor there, and you know um, female to male, and peeling skin off to make an article of your body that God didn't give you, and they end up with gangrene in their arms or thighs or whatever, where they've taken the skin to try to make that body part that they were not given at birth. And, then the ones who are getting the puberty blockers and everything, when they get in their 40s, and sometimes younger, they get osteoporosis so bad and they're in extreme pain. And there's a lot of things that goes on with that transitioning that you're not looking at the long-term effects, it seems.
Yeah, the long-term effects aren't discussed. They're not properly introduced to people who are like looking into transition. I know, like, the thing too is that what will happen is that, um, women will have their ovaries removed, or um, men will have their testes removed, and the thing is, like, when you're removing a part of your body that you need to produce hormones, and
Hmm.
so that causes all these other health issues, and then you're forced to take synthetic hormones, and it's just
Hmm.
it's difficult because, like, well, how much is this synthetic actually like the real thing? And so
Right.
instead of your body producing what it would naturally produce, you're putting a synthetic in your body, and you're going to work with this doctor that's going to try and, like, I guess, match you to what they think you need, but it's not what your body would actually produce by itself. And the bottom surgery, I'm shocked about how there's a reason why there's I know of trans people like Blair White, um, and they, there's just so many people who won't even do the bottom surgery because they know that it's so risky, and they know that it has this huge failure rate. And I've just heard these horror stories about, they have to make sure the hair is removed because the hair can cause infections, like on, like, the arm and such, or the leg. Like, they have to make sure that that's removed when they use that skin to make this fake penis, because it's going to cause issues down the road. And then you hear about somebody like Richie, and he had bottom surgery, and how it would take him, I think it was like 30 minutes to go to the bathroom. And it was just like, he just talked about how messy it was. And I was just shocked that they were doing this. Like they thought that these types of surgeries were okay, even though they have such a low success rate for doing these surgeries. And I don't know how, like, I mean, for me, it's just like, they never presented a study about like, okay, you want to transition to this non-binary gender. Here are all the studies showing the success rate of that. Like, nobody talks about the success rate of transitioning to a non-binary gender. Like, there's just not, there's a lack of discussion. There's a lack of honesty about that. And two, like, you're dealing with people who, many of them, like myself, are desperate because we've tried everything. Like, I had done 20 years of traditional talk therapy. I had done 2 rounds of transcranial magnetic stimulation therapy, and I was desperate when I wanted to get this top surgery because I had done everything else. And instead of looking at something like, okay, well, instead of looking at, well, is there another way we can address your drama or your trauma? Is there another way to, like, is there another physical issue that we're not looking into? Is there, maybe you should see an endocrinologist before we even consider you for something like top surgery? Like, none of these things had ever been discussed.
That's what terrifies me, because so many people are not informed about, the entire aspect of it. And, they don't look at the horror stories. They don't research those horror stories. They just go ahead and the doctor says, oh, yeah, fine. I don't want to be transphobic. Here, you can go to this person and this plastic surgeon or whatever, and they'll do all the stuff you need to do. And then all of a sudden you're going to be a boy or you're going to be a girl. That doesn't work that way. The body is not designed that way. And I think about all the little girls that, 10, 11, 12 years old or whatever, and they start the puberty blockers, and then they remove their ovaries and their fallopian tubes and, their uteruses and stuff. And it's like, okay, you've just destroyed an entire new generation, it seems like. You're feeding into this public delusion, I guess. I get angry about people mutilating their children that way. Parents need to pay attention and do more research, and I don't think they're doing that.
No, and that's really the tricky part, is that there's that lack of honesty, because where are you going to get that information if people don't have all the information? They can't make an informed decision. And
Right.
doctors aren't going to give them that information. They're going to give them the affirmation, gender affirmation information. Because, I mean, just the sad thing is that those girls, and I mean, I've known adult detransitioners as well, and adult women, and they had everything removed, so they don't have a uterus, they don't have their ovaries, they can never have children. These women can
Right.
never have children. And I mean, I can never breastfeed, and that's been hard.
Yeah,
It's
I've seen videos with Chloe Cole, and she was talking about that too. The fact that she had the top surgery and she'll never be able to breastfeed a child, and that the sensation is gone there, because of that surgery.
yeah, yeah. It's sad. It's so sad that this is happening, and instead of like looking at what else is going on, and that, I mean, a lot of these kids are just, they're a little bit different. They have ADHD, and that's the other thing, the comorbidities. Like, a lot of these kids and adults that transition, they have ADHD, they have autism, They have other mental health comorbidities. And so we're having all this going on and we're not looking at it and addressing that. Instead, we're just saying, well, you can just get a top surgery and you'll feel better. And the thing is that as somebody who's had top surgery, I developed a lot of health complications after that. So, I mean, like, I don't have great sensation. There's some pain in some area. And well, at my left nipple, there's a little bit of discomfort there too. Um, I mean, I had a lot of things that were connected to the surgery, but are like weird, if that makes sense, because they're like, I had skin discoloration days after the surgery. Let's see here. I mean, I had trouble swallowing and that went away. And I developed bony promises. I developed Raynaud syndrome, and all this happened days after the surgery. So
Wow.
there's some sort of connection to all these like strange health complications I had in the surgery. And maybe it was just too overwhelming for my body. I don't quite know what went on, but I do know my doctors started taking me seriously at first. And then once they thought I had psychosomatic fever, because I was having this burning sensation in the back of my neck, then they stopped taking me seriously. And they were like, okay, you just need to see a psychologist. And I'd done all this therapy, so I knew that wasn't the answer. And so I just really worked on my physical health. I mean, unfortunately, after the surgery, I got tinnitus, and I still have tinnitus in this ear.
Mm-hmm.
But it is weird because it is this sort of inability to look at the larger issue and to try and save people from doing something that's completely unnecessary. And the thing is, I'll still have scars. Like, I'll have scars for the rest of my life.
Right.
All these people who transition, they're going to have those scars. They're going to have all these health issues for taking these hormones that they don't know. Like, I was talking to Buck Angel, and the thing is that teeth issues.
Yeah.
And the thing is, like, who would think of like teeth issues? And who knows? Maybe that's not related to transitioning. But that's really the thing, though, is that we just don't know how much putting in synthetic hormones into a body that was never meant to receive those hormones, how much that's going to impact the body and what parts of the body that's even going to
Right.
impact.
Yeah. Yeah, I just don't understand all of it. And I fully admit to that. I don't understand all of it, but I do understand the fact that, your health, your physical health, and your mental health, and so forth, your body's designed a certain way when you come out of your mother. And, that's the way you're supposed to be. I'm not big on any kind of drugs, whatever, whatsoever. And I've got lots of health issues, but I try to wean myself off of any kind of medication. I'm not into synthetics, okay? I don't think the pharmaceutical companies have a great understanding of what our body needs. And, when you're doing this synthetic stuff, I think you can probably do more harm than good in a lot of respects.
Yeah, it's better to work with things that are going to be compatible with the body, things that are going to be more bioavailable. Like, I think diet's a big thing. And I mean, nobody ever talked to me about diet either. And I have been pescatarian. So I was eating fish as my only source of protein for like over 10 years. And I wasn't getting enough protein either. So, like, instead of saying, like, okay, well, maybe you can try eating meat again and see how that makes you feel, because that's, there are things that you can get in meat that you can't get in plants. Like,
Right.
and that's kind of the tricky thing too, is that there's many of these individuals may be vegetarian or vegan, and they're not getting the nutrients they need. And you need nutrients to function. Like, they did a study it was on dogs, and what they found is that they fed these dogs oatmeal, and the
Mhm.
dogs who just ate oatmeal developed rickets. So what you
Yeah.
put in your body is going to actually impact you. But
Mhm.
it's kind of weird that we don't even look at something simple like diet to see like, okay, well maybe your diet, maybe you're eating all these processed foods, maybe you're eating something that's not agreeing with you, that you're allergic to. I mean, I think there's talk about things like these dyes, like impacting hyperactivity and
Yeah.
yeah, and like hyperactivity in people with like ADHD. And so it's like, well, maybe there's an ingredient. Like my grandmother tried to take a form of Valium because she was that's what she took to deal with her mental health issues. And so she took Valium, and one day they switched her to the generic. Well, the
Mhm.
generic caused her to break out in hives. And so
Oh
they're
my.
thinking that, okay, well, it must be the dye in the generic. So then they switched her to the main brand. But it's what we put in our bodies has a huge impact on us. And yet this is something that's really a small thing that doctors could do to actually look into say like, hey, like maybe I know like maybe if you don't want to, or maybe if you're a vegetarian or vegan, you can look into something like, you know, free, like something that's like free range or, regenerative farming or something. Like you look into other options that will
Right.
make you feel better about your choices, but like seriously consider something like, eating meat again. But that's not the first route of action that these doctors are taking.
Yeah, and I'm a big proponent of organic foods. I raise my own beef, so I know what I'm eating there. But if I go to the grocery store, I won't buy various brands of chicken because it's not organic, and I feel like if I and studies have shown too that with our children, we have so much stuff going on with farmers growing our vegetables and things like that, where they're using chemicals that, you know, a bug bites your corn in the field, the bug's going to die. Well, I don't want to eat something like that. You need to look at whole foods and, get a broad range of organics and so forth, because I think the processing and the chemicals that are used in our farms, and you can't it's hard to buy organic seeds anywhere anymore. I keep a supply of heirloom seeds because I don't want anything that's been genetically modified. And I think those genetically modified foods are probably impacting our children, and they've shown that it has impacted their learning abilities. I know I've got two autistic grandkids, and they said to look into their diet. I had a very good teacher that said look into their diet first, and we got them on, organic foods and everything, and it has helped in the process. And I don't think they're doing that with those who want to transition.
Right.
I think you need to look at the diet first, okay?
Right. Exactly. And like I was saying, that's like a non-invasive thing, and that's the crazy thing is that we're doing these really invasive, expensive surgeries, and hormones. You have to like pay that. Somebody's having to pay for that. Insurance or the individual is having to pay for that instead of doing something simple like diet. And
Hmm.
yeah, I mean, it's amazing. Like there was a TED talk, and she was the woman there. I think it's the Reed diet, if I remember right. She was talking about how she was able to reverse most of her daughter's autistic symptoms through diet, and it was
Right.
amazing. It's I've been able to do and feel a lot better through changing my diet. I know I was really thankful my gynecologist picked up on the fact that I had low ferritin levels. So
Hmm.
before the surgery, I was at, let's see here, I was at 90 for my ferritin levels, which are like your iron stores in your body.
Right.
So after the surgery, I was at 17. And they
Oh,
didn't
wow.
find this out until I think almost like half a year later. And so, and that was the thing, like nobody was checking this. Like nobody said, well, let's look at Camille's ferritin levels and see how she's doing. Nobody had checked that, and so I had so thankfully, because she had said, well, let's see about getting you hooked up to an IV. And I'm like, well, I want to see if I can do this naturally. So I started eating liver, which I thought was disgusting. Like, I don't like the taste of it, but I ate liver. I had like liver supplements as well. And then I just started eating a lot of like red meats, and my ferritin levels are at 70. So I was able to get those up naturally. So
Right.
yeah, I mean, that's the thing too. It's just like, let's see, instead of thinking that, okay, this person just wants a pill, what natural options do we have for people?
Right. I'm I think that anyone considering transitioning should probably first make their first stop at a naturalist who is going to, take blood work and do, you know, twice as much testing as just the physician you normally go to, and see where your levels are on all kinds of different things, so that, you are able to figure out if there's something you can do to level you out, and, maybe get your head clear. Because if your physical body is attacking you from the inside, that's going to affect your mental health and so forth. So you need to, explore that before going to the option of mutilating your body in some respect.
Right. Yeah, and there's like, I think another thing that's really interesting is kind of going back to inflammation, is that there was a study, and I think it was like 46% of people who did not respond well to antidepressants had high CRP levels, which is high inflammation in the body. So instead
Mhm.
of, so that's something that I think is going to be kind of a shift in how we look at things, is going to be looking at mental health through the inflammatory model. And there's a functional medicine doctor named Dadis Karazian, and he was talking about like how they're finding out, like, which I don't know if you saw that, there was the way they thought like that there's a chemical imbalance in the brain and that was
Mhm.
causing depression. They found that that's not the case. And so what this functional medicine doctor was talking about was that they're thinking that this is going to be related to inflammation, and so that depression is caused by inflammation. But it'll be interesting to see how things change, because I think that there is a shift in how we're looking at mental health, and being linked to physical health.
Yep. Well, I certainly hope that they start doing a little more than just saying, okay, fine, let's go have surgery. And because, like I say, over 50% of those who have transitioned are suicidal these days. And that breaks my heart. Everybody deserves a happy life. And, if you can't have that because you've got a physical problem, well, then, you've lost everything, in my opinion. So, but anyway, we've run out of time here, and I thank you so much for joining me. It's been very informative, and I hope we can help get the word out more. And like I say, she is with dtranshelp.org. And if you're in a position where you're wanting to detransition, or if you're in a position where you want to transition, call them and reach out to them, because I'm sure you all can give them the ins and outs, and give them a warning that their physical doctor is probably not giving them.
Yeah, we can do that. And yeah, thank you for having me on. I really appreciate it.
Yep. Well, thank you, and we'll see everybody next week. Thank you for joining us.